In this video, we will take a look at how we define and measure body weight. In 2016, Sports Illustrated Swimsuit Edition broke tradition by using a plus-size model on their cover. Controversy ensued among health professionals and the public about whether it is a good idea to promote overweight body types. While the controversy has not ended, the media has embraced women of all sizes. The question is, how do we know what is healthy or not? And unfortunately, this is a complex topic because health involves more than just physical aspects. There are 6 dimensions that make up a person's wellness. One does not have higher importance over the other, and most interact with each other. To have total health and wellness, one needs to have balance within and among all of the dimensions. While nutrition interacts with all 6 of the dimensions, we will focus on the physical aspect of health. However, I wanted to make sure before this discussion on weight that you understand weight is only one aspect of one dimension of wellness. 74% of Americans are overweight or obese, with 42% being obese. These are glaring numbers with severe consequences for chronic disease. So while it is only one aspect of wellness, it can have some major implications on physical health that affect longevity. It also affects other aspects of wellness like emotional health, work, and social life. The gold standard that we use to determine healthy weights for an individual is body mass index, known as BMI for short. The BMI measures the relationship between your height and weight. You can find BMI calculators online, including within your course. Once you calculate your BMI, you will get a number that you compare to the ranges you see on the screen. 18.5 to 24.9 is considered normal weight, 25 to 29.9 is overweight, 30 to 34.9 is obese, and over 35 is considered morbidly obese. But does this number work for everyone? Let's take a look at the average NFL football player. Every position on the team has an average BMI that is overweight or obese. It certainly does not seem to be a detriment to these players. But not all players are created equal. Let's take a look at 2 brothers playing in the NFL. On the right, we have Jason Kelce, who is a center. That's the guy who snaps the ball to the quarterback. On the left is his little brother, Travis Kelce, who is a tight end, who does some blocking and routes to sometimes catch the ball. Both are on the offense. One is borderline obese and the other obese by their BMI. But looking at the 2, I suspect you might say that despite them both being over a healthy BMI number, there's probably a significant difference in how healthy their weights really are. I don't think anyone would say that Travis is at a health risk, but some might question if Jason's is healthy. So what is the difference? The difference is body fat. Lean mass is very dense, so as you pack on more muscle, it can add more weight than fat tissue of the same size. Clearly, Travis Kelce has more lean tissue than his big brother Jason. This is true for many professional athletes that require strength and speed. Many of the positions on a football team require these characteristics. Over the years, players have become more and more lean, which increases their weight and BMI. Another thing we have to consider with body fat is where the fat is located on the body. We have 2 different types of fat. One is called subcutaneous. It is a fat layer that is just under the skin, and you will often see subcutaneous fat in the hips, thighs, and buttocks. The other type is visceral fat. It is intra-abdominal and will show up on the belly. We call this type of fat central obesity. It has a very high risk for high blood pressure, heart disease, and type 2 diabetes. Even with an accurate body fat percent, our best bet is to measure the waist for central obesity. When combined with BMI, this helps us gauge a person's health risk more accurately. A waist circumference greater than 40 inches for men and 35 inches for women has shown to be too much visceral fat, putting them at higher disease risk. Their disease risk is identified by an asterisk in the chart. So a person with a BMI in the overweight category with a high waist circumference is at a high risk. And a person in a class 1 obesity with a high waist circumference would be at very high risk for disease. Once the BMI is greater than 35, it is considered very high or extreme risk. The most prominent disease risk for those who are overweight or obese are heart disease, high blood pressure, type 2 diabetes, and sleep apnea. However, we also see joint problems, fatty liver disease, gallbladder disease, some types of cancer, and poor emotional health. Alternatively, being underweight is problematic as well. A BMI under 19 is considered underweight. The lower the BMI, the higher the risk. Those risks include lowered immunity that makes a person more susceptible to infections and getting sick, delayed wound healing, iron deficiency anemia, and other nutrient deficiencies that cause hormonal abnormalities, osteoporosis, and poor growth. It can also lead to performance problems such as in school or athletics and difficulty getting pregnant. Remember, our goal is health in all areas of wellness. Body weight is only one of these. Health in one aspect should never interfere with the health of another area. For example, trying to lose weight should not cause you to develop an unhealthy relationship with food. Unfortunately, this is common in dieters. They may get so caught up on dieting rules that they restrict too many foods, become anxious, and avoid social interaction, where the rules may be compromised. In this module, we will focus heavily on having a good relationship with food while making healthy choices of all types of food and exercising to reach your health goals. Thank you for staying with me until the end. Enjoy food and work towards health in all areas of your life.